Welcome back. As part of our Eyes on Diabetes series running during the month of November, we are learning more about the importance of scheduling our annual eye exams. So on behalf of our sponsors at Johnson & Johnson, the makers of AccuView contact lenses, MacuHealth, Pacific Cataract and Laser Institute, and the Oregon Optometric Physicians Association, today Nicole DeCosta is learning all about cataract surgery and laser vision correction.
Now, tell us about PCLI and what it stands for.
Yeah, PCLI is my employer or my practice where I work. It stands for Pacific Cataract and Laser Institute.
Well, it's perfect. How long have you guys been around?
Well, the organization was founded and has been around since about 1985. Started in a small town in Washington, Chehalis, Washington, which is about halfway between here and Seattle. And so, yeah, we've been around for a while.
Yes, it's great to have another local company joining our Eyes on Diabetes series for the month of November here. I'm curious some of the services that you guys provide.
Yeah, we are primarily a surgical center specializing in cataract surgery and laser vision correction. We have about 17 locations in 6 states, and our surgeons have performed over 700,000 micro eye surgeries over the last 40 years. So we've definitely had, a lot of experience with cataracts and cataract surgery, and also a fair number of those patients have been diabetic. So we do see quite a few.
Yeah, absolutely. And those are some big numbers there. So this is something that scheduling those annual eye exams is just so important to stay on top of our eye health, correct?
Absolutely. It's, one of those things where diabetes can go undetected in the eye for a number of months and years. And unless you're specifically having the eyes dilated to take a look at it, some of those effects can go unchecked and become problematic down the road.
Yeah, it's good to stay on top of everything. We've been just educated this month, so it's great to learn more, and especially about your company. We're so glad you could be a part of this campaign. I know giving back to the community is so important to your company, so tell us about that.
Yeah, thanks so much. Yeah, a lot of our doctors, both ophthalmologists and optometrists, as well as a lot of our staff, volunteer their time going on surgical mission trips across the US and really have gone worldwide, really. We're also a longtime supporter for the Oregon Optometric Physicians Association, who you maybe spoken with earlier, and support more, all of their 700 plus members. So it's nice to be able to be a part of a company that gives back to the community like that.
Absolutely. And you're part of such a large network, like you were saying, how PCLI works with optometric physicians in the community. Break that down for us. How do you guys work together?
Yeah, so we, like I mentioned, are a co-management surgical center. And what that means is that our team works really closely and complements the skills of family eye doctors throughout our referral network, which includes the state of Oregon, Washington, Idaho, Montana, Alaska, and New Mexico is where we, the primary region that we serve. And so if a patient in a family practice needs to have surgery, many times they will get referred into us. We perform the surgery. And then, once the surgery is completed, we get the patient back to their family eye doctors for the remainder of their care.
Oh, gotcha. That makes sense. And speaking of, diabetes in particular, what kinds of diabetes related eye surgeries do you perform?
One of our most frequently performed surgeries that we offer is cataract surgery. And with cataracts, with patients who have diabetic, a lot of times the cataract will come on faster and earlier in patients who have diabetes, especially uncontrolled diabetes. And so while most people eventually will get a normal age-related cataract, we see them a lot sooner and maybe a lot more aggressively in patients who have poorly controlled diabetes. So before a patient, comes in, a lot of times before they are slated for surgery, we will try to make sure that their systemic and ocular health is kind of optimized so that they get the best outcomes from the surgery, whether that means working with their primary care doctor or endocrinologist or retina specialist if they have them. We just want to kind of take a team-based approach to make sure that patient has the optimal timing for their cataract surgery or other surgery so they can kind of get the best outcome possible on the tail end of surgery.
Yes, and knowledge is power. So that's why we really want to encourage people to schedule their eye exams, of course, here in November and all year long. But I'm curious, what message do you have for individuals with diabetes regarding eye care?
Yeah, I encourage, regular comprehensive eye exams with a family eye doctor to check the status of your ocular health. There's a lot of diabetics in the state of Oregon, approximately 300,000. And even more interesting is there's about 100,000 people who have diabetes but don't know it yet. And it can be a disease that is silent until it's not. And so what happens is these tiny blood vessels in our body, and especially in the retina, become susceptible to leakage, and that leakage can cause blood and fluid to be in the retina space, where it's not intended to be or not meant to be. It can cause prescriptions to change very rapidly from swelling of the lens in the eye. And so we just want to make sure that that's caught before it becomes a more severe situation. And diabetic retinopathy is a leading cause of vision loss in blindness in adults. And so getting an eye exam is really an important first step in just making sure, getting a diagnosis before the problem becomes vision threatening, essentially.
Exactly. And in talking with some of the optometrists in the area, a lot of folks go in saying, "Oh, it's time for my new prescription. Things are looking a little
Right.
blurry." But that very well could be that, or it could be something else. So it's truly amazing what we can see just from an eye appointment.
Right. Yeah.
Oh, this is so great. Anything else that we need to know?
Well, thanks so much for having us. PCLI is very proud to support the Eyes on Diabetes campaign. November's Diabetic Awareness Month, and we hope that the public awareness from this campaign brings people in to see their eye doctor, and we can help prevent a lot of eye damage and blindness that way.
Exactly. It's so important to stay on top of. Thanks for joining us and everybody at home. This
Yeah.
November, be sure to schedule your eye exams. For more information and to sign up for an exam, visit OregonOptometry.org. And from there, you'll be able to learn more about the sponsors of Eyes on Diabetes and all the ways you can schedule your eye exam. Thank you so much for joining us today.
Thank you.
You can always visit OregonOptometry.org for more information. And a huge thank you to our sponsors at Johnson & Johnson, the makers of AccuView contact lenses, MacuHealth, Pacific Cataract and Laser Institute, and the Oregon Optometric Physicians Association.